Hello, everyone. Can you hear me? Okay. Good evening. On behalf of the YMCA of South Florida, we wanted to welcome all of you to the LA Lee YMCA Mizell Community Center. We're thrilled to have you here. This is our Victory Black Box Theater. If you've never been to this YMCA before, it's our newest Y, and we invite you to come back at another time and take a tour and learn more about this sacred land. We wanted to welcome you and thank all of the amazing sponsors that helped make tonight possible, and especially Memorial Healthcare System for being the presenting sponsor. Thank you so much. And then lastly, I just wanted to thank Riza and Trisha for sharing their personal journeys with us. It's been wonderful getting to know you. Thank you for sharing and bringing this very important conversation to all of us in our community. Thank you.
Good evening, everyone. My name is Trish Widowfield, and I'm the Vice President of Miss Esquire. And more importantly, for tonight's conversation, I'm a survivor. I lost my brother 11 years ago to suicide, and I am so grateful to have this platform, an opportunity to channel that grief to help others. We don't want any other family to go through this. So thank you for being here, for yourself and for each other. For all of our Miss Esquires out there, thank you so much for your support and for promoting this event. It's so important to me and Riza, and we really appreciate it. Thanks to my firm, thanks to my husband, thanks to my friends for supporting me, not just for tonight, but over the years. Talking about support, let's talk about our sponsors. It was so important for Riza and I to have this event be free and open and accessible to the public, and we couldn't have done that without our sponsors. Our mental health champion, who is also our title sponsor, is Memorial Healthcare. Thank you so much. Mental health ambassadors, we have Recovery Unplugged, as well as NeuroHealth. Our mental health advocates are Dylan Shop Sunshine Foundation and 211 Broward. And our mental health pioneer is GIA Healthcare. We also have mental health supporters, Annie's Choice, Counseling Group of Florida, and Futures Recovery Healthcare. Special thanks to Magna Legal Services, who have live streamed this event and are videoing it so we can reach a greater audience. We also thank all of our vendors who have more information at the tables out front. We have Hanley Foundation, NAMI, Florida Lawyers Assistance, Amen Clinic, AFSP, Wonderful Boxes, and we also had 150 gun locks donated to us. With that, I'm going to turn it over to the founder of Miss Esquire, Riza Vargas Cheng, who shared this vision with me many years ago and has worked tirelessly on this program.
Okay, well, first, I want to thank everyone for attending our first mental health and suicide prevention event. I want to again thank the Y for hosting us and having us and co-hosting this event with us, which I think was extremely important. But I also really want to give a shout out to Amy, who from our very first conversation really believed in this event. And so we appreciate so much that we came all together to be able to host tonight. My name is Riza Vargas, as Trisha had mentioned, and I am the founder of Miss Esquire, which is the largest referral networking group in the entire country for women attorneys. And I'm sure you guys are thinking, what do women attorneys have to do with mental health? So I will get there in a second. And I have the distinct honor of co-hosting this event, as I mentioned, and giving you a little background of two incredible people who I love dearly with all my heart. So today I'm going to introduce first Trisha, who's already been up here, but a little bit about her background. She's the vice president of Miss Esquire, who I met only 5 years ago. Can you believe that? At a lunch that she invited me to, which I originally thought was to talk about launching Miss Esquire, the networking in-person chapter. But at that very first lunch, she decided to be vulnerable with me And in tears in her eyes, she confided in me that she had lost her brother to suicide just a few years ago. In that moment, her vulnerability allowed with me to share that the love of my life, my husband, too, had struggled with depression and suicide ideation. I knew then and there that God had orchestrated this lunch for much more than launching Miss Esquire. He was getting ready to launch and ignite a desire and calling to provide other families like our own with resources and tools to not have to go through such imaginable pain. So second, I want to introduce my husband, Christopher. Chris, it has been an honor to get to love you for the last 18 years of my life. To me, you are my entire world, and I'm proud to be your wife. But most of all, I promised I wouldn't cry, so I apologize. But most of all, I'm proud that you're vulnerable and honest enough to create a space to share with others your own struggles, even if to just help one person in the room. I'm grateful you have said yes to sharing your testimony tonight and have spent the last few years helping others in very similar journeys. This is just the beginning, and I'm excited to be along for the ride. Unfortunately, Trisha and Chris's story is not unique. Every 11 seconds in the US, one person commits suicide. Tonight, our intention is to have a candid conversation on mental health and suicide prevention with our distinct panel, which Chris will get an opportunity to introduce in a second. Our goal is to bring hope and to equip all of you with resources through our tables outside of incredible organizations that have partnered up with us, and the manuals we took months to create, where we list every single provider and resource from free counseling to every university in the state of Florida, and that's at everybody's seat. Before we start tonight's presentation, we have created a video that we would like to share a little bit more about Chris and Trisha's story.
For me, depression is wild because it's the same, but it's different for everyone. I always like to use the metaphor of being cast out to sea. Most days, it's a flat ocean and you're good, but every so often you can kind of sense something on the horizon, and before you know it, you're finding yourself in these like 50-foot waves, and you're just swimming for your life, and you're just trying to keep your head above the water, and you don't know if it's gonna last hours, days, maybe even sometimes weeks. And so you just have to constantly remind yourself to keep swimming. You have to keep your head above the water. But for others, it's sometimes one storm too many.
Brian had a laugh and a smile that just lit up the room. I mean, you never had to question if he was in the room or not. You knew. He made you feel special. He made it fun. We were only 2.5 years apart. So growing up, it was like everywhere we went, it was always like, Brian, take care of your little sister. We enjoyed being together. We grew up on a Christmas tree farm, so very hallmarky. A lot of work, but a lot of fun.
Growing up, you look at your heroes as these perfect, infallible, characters, and you don't think that they have problems or struggles. And for me, my uncle was my hero. He was this larger-than-life person. In 2012, my uncle killed himself. It was something that was really hard. Suicide is always hard, and I think just even being able to say the word suicide is a show of strength. There's a taboo on the word, and I think we need to, as survivors, as loved ones who know people who battle depression or have lost someone to suicide, that we reclaim that word.
It's obviously the worst day of my life, but my mom sent me a text, and it said, I need to talk to you, but I need to make sure that you're in a really safe place. So I knew something horrible had happened. And for me, like, the hardest thing is to put myself in their spot of, they just got the most terrible news of their life, and then they had to call me and let me know what happened. And it's been 11 years, and this is still how I feel whenever I think back to that day.
I remember the night back in 2015 when I basically decided I was going to take my own life, and I was on a 5-night bender of drinking, drugs, no sleep. I was like, there's 3 options I have. I can jump off this balcony, I can go take pills, or I can shoot myself. And my worst fear was of heights, so I was like, balcony's out of the way. And so I made the decision, I'm gonna go grab my gun because it's the fastest and it's gonna be the easiest. And I remember walking to go get my gun, and this voice, or this urge inside of me, told me to lay down. I remember audibly laughing because I hadn't slept in 5 days. And before I knew it, the urge to grab my pillow and lay down on my couch was stronger than the urge to grab my gun. I woke up the next day after a full night's sleep, wondering how I got there, how this happened. When you're in the pit, when you're in that dark circle, you lose hope. I told myself, every day, I have to get better. Every day, I have to keep swimming. I have to keep my head above the water.
So my friends came over that day just to be with me. And I live on a marina, and I said, Liz, I know that I'm an emotional wreck, but are those bunnies? And there were these bunnies at the base of the lighthouse. I'd never seen them before. I'd lived there for 13 years. And then I started seeing more and more of them. So we adopted Theo and Vincent. We still have them 8 years later. And so I call them my bunnies from heaven. I think that, whenever you go through something so tragic, you have to find a connection. Who knows why he sent me bunnies, but they're comforting.
Therapy for me is a non-negotiable. A lot of us, we're in this hustle bustle world in this society that we live in, and we don't get that time to share because we're worried about what others will think. We're worried about how we'll be perceived, and so we bottle it inside and we isolate, and then that just over time just starts to tear away at you. It's what people who live with depression, anxiety are yearning for. They're yearning for freedom from themselves. So when you're able to release that, you're emptying that, you become lighter. It's a holistic approach. You have to get sleep, eating correctly, exercising, getting outside. They allow you to be your best version. Finding and walking with God completely changed my life. When you're up here and you're by yourself, you have a reminder that there's a Savior and there's someone with you in the boat who is asking you to lay your burdens down.
Brian did have some struggles as he got into his later teenage years with some depression, bipolar. So he was on medication. You hear of people who stop taking medication because it dulls their personality, and it did. We had an identical childhood, and we both grew up so happy. I can't really even imagine it because even now I've never experienced it. It's hard for somebody who hasn't gone through it to understand. And that's why I think there should be a lot more attention to it.
If you take a breath and you understand that this pain is only temporary and you can see yourself getting to the next day, you have to want to get better. You have to want it. For me, I was just sick and tired of being sick and tired. There is a way out. There's always a way out, but you have to want it. The second part is finding a community, finding, whether it's your family, a group, a support group, who will help carry you through those times. It's just baby steps. Don't try and fix yourself overnight. Understand it's a journey, it's a marathon. You have to keep going, and you just have to keep putting one foot in front of the other. Know it's temporary. Do not make a permanent decision based on a temporary emotion. Seek the help, lean into it, and just do the same thing one day after the other.
After he died, even my closest friends, they didn't want to talk about anything. I don't know if it was because they were uncomfortable or they thought it would put me in a bad place or they didn't know what to say. And I really think that we need to get away from that. I think for anyone who's struggling with mental health, they're so brave for acknowledging that that's how they're feeling, and hopefully for telling somebody that's how they're feeling. Every single person who's out there has value beyond what you know. And please speak up, use the resources that are available. Sometimes it's okay to be selfish and focus on yourself until you get into that better place.
The joy that I have right now is telling my story, giving someone else hope. Is allowing someone to never feel the way I felt that night. I find joy in knowing that hopefully someone will see this, even if it's just one person, they'll go get the help they need. That's the joy I have. And my children, always. Gotta throw the kids in there, right?
Awesome. So I do encourage you guys to take one of these manuals. You probably know somebody that is suffering in silence because most people don't actually ever share their story. So we appreciate everybody for attending today. We're going to be moving the chairs really quickly, but I do want to thank again the YMCA, the Daily Drip for introducing us actually to Amy, Fifth and Core, who did an incredible job at helping us with some of our social media, and Danny, is Danny here? Danny, my assistant, who actually helped us the last 6 months put together every single resource in this book, which took us forever, but we appreciate you so much.
Hello, everyone. I'm Chris, as you all got to know. Before we get started tonight, I'm going to introduce our panel. Just hold your applause till they all come up on stage. So our first panelist is a licensed clinical therapist at Memorial Behavioral Health Center. She started her career at Memorial 13 years ago, working with adolescents with substance abuse disorders. She is currently working with adults with co-occurring disorders and facilities groups and individual therapy. Gretchen Haddad. And then next we have Dr. Kessler. Dr. Kessler brings over 3 decades of unparalleled expertise in mental health care. Throughout his career, Dr. Kessler has witnessed the evolution of mental health care firsthand, embracing each shift and cutting-edge innovations to battle mental health issues. With more than 30 years of patient care, including more than a decade serving our veterans at the VA, Dr. Kessler recognizes that the impact of psychiatric care extends far beyond the realm of medicine and is driven by a singular mission to instill hope in those who are struggling toward a life of fulfillment and purpose. So, Dr. Kessler, would you join us? On, perfect. And we're good. And we got water. Okay. Should we all take a deep breath? Congratulations, you guys are all witnessing, and we know that this is a panel talking about mental health, but you're actually all gonna sit in a therapy session for myself, okay? Hope you guys are ready. I got 3 kids under 4, so we're gonna get real deep into this. But no,
We're not going there.
Yeah, no, exactly. On a serious note, I would like to thank both of you for making yourselves available. I think an event like this, I think a discussion like this is always needed. I think there needs to be more of both of you in this world, and you guys should also be recognized for what you do. It's an incredible part of our society and a necessary part of our society, so I thank you. Also, I forgot to mention, I need to thank 3 people in this room, Riza, Trish, and Danny. I got to be that person in a group project who did absolutely nothing but got the A anyways, but these 3 women have been literally breaking their back for over a month now to put this on. This is not something we were just like, hey, why? Do you have a room we can get into and just rent? And they were like, yeah, sure, just come on down. And we just set up some tables. It's more than that, and you ladies are incredible, and I'm honored to moderate this panel, and I'm inspired by all 3 of you. Danny, you're the real MVP. And I thank you guys for hosting this. So let's get into it, okay? First question, what would you guys say, I'll start with Gretchen first, what would you say are the most prevalent mental health issues facing our society today?
One, is this on?
Yes.
I'm going to answer that question, but I want to give you a shout out and thank you for sharing your story.
Yes.
And Trisha, you as well. That was really an incredible thing, and I think it's important to have the open conversation and the courage to be able to do that. Some of the most important issues that we're seeing right now in the mental health field, we're seeing people come into our emergency departments with an overwhelming diagnosis of depression, anxiety, substance use disorders, the fentanyl crisis, co-occurring disorders, if I didn't already say that. I know the PEDS unit is getting inundated at Joe DiMaggio Hospital with children who are self-harming and suicide attempts. We're also seeing the increase in adults as well.
Could you explain what the co-occurring instances
Co-occurring
are?
disorders? Sure.
Yes.
So co-occurring disorders are when a patient might have a primary diagnosis of a substance use disorder and then a secondary diagnosis of a mental health disorder such as a personality disorder, mood disorders, schizophrenia.
So before we get too far into this conversation, I want everyone in the room to have like a starting point. So Dr. Kessler, how would you define depression? What does depression look like? I know personally, but maybe someone doesn't. It's not just a sad day. Could you maybe expound what is depression?
I'd be happy. I also want to echo your comments. Thank Ms. Esquire and yourself for doing this. to have an opportunity to talk about mental illness, which is something that has for a long time been something that people don't want to talk about. Been a long time that people wouldn't want to admit that they saw a psychiatrist or a therapist. It's only relatively recently that people have been much more open, and I think thankfully, to share their stories and what used to be silent suffering. The isolation that comes with that doesn't help that person or anyone else. So again, thank you. So depression is one of the most common mental illnesses. It is something that over the course of a lifetime, people may experience due to stress. Some people are more vulnerable due to a family history. Genetics may play a role in how we respond to stressful events in life. Some people seem to sail through, and others struggle more with depression. One thing about mental illnesses is they have similarities to what people experience in sort of normal, everyday life, like sadness, anxiety, we all experience, right? It's part of our panoply of human conditions. It becomes a clinical phenomenon when it becomes more severe, persistent. It becomes like, for depression, it becomes like a bag you can't get out of. So, right? So normally something upsetting happens, we're sad for a little while, but then life drags us back into it, and we let the sadness go. In depression, you can't. So it's persistent, it's day after day, everything seems gloomy. One of the aspects of depression, I think, that a lot of people understand the sadness part. I think one thing that's distinctive about clinical depression is the loss of the ability to feel pleasure or joy. And that just makes it distinguished. And can imagine living life where nothing gives you pleasure. Nothing feels enjoyable. You don't look forward to anything. Nothing interests you. You have no motivation, therefore. Why do you want to do anything if it doesn't give you a sense of joy or pleasure? So clinical depression is when it's like that for at least a couple of weeks. That's what we call a major depressive episode. And there are usually other symptoms. There's a lack of interest, difficulty concentrating, difficulty sleeping, may lose your appetite. Some people get the opposite, they eat more. Suicidal thoughts may be part of it. Sometimes we talk about chronic depression, where it goes on and on. So you can imagine living like that for prolonged periods of time. But depression tends to be a recurrent thing. People may get an episode, it may last a couple of weeks, a couple of months, and then it may come back at another point. And it's the black cloud coming back. And I'd be glad to talk more about that, but that's kind of the overview, I think, of how to think about it.
Gretchen, was there anything you wanted to add?
No, I think you covered it pretty well.
But you had mentioned, and you did as well, Dr. Kessler, we were talking about anxiety, and I had learned in my own journey that anxiety is usually tied with depression. So let's actually get a definition of that before we move any further too. What does anxiety look like?
Sure. So anxiety is an emotion, and anxiety can help us to act on behaviors. So like, right, if you had to speak in front of a bunch of people, that produces some anxiety. So you have to kind of prepare ahead for that, right? Sort of like if you also went on a job interview, if you went on a first date, those are normal situations that are anxiety provoking. When anxiety becomes debilitating, what it would look like would be having ruminating thoughts, worrying too much, worrying so much about different things, not being able to make decisions clearly, difficulty concentrating, and then what it would look like physically, right? If you've ever experienced anxiety, you know, what does it feel like in your body? You might be sweating, your heart might be racing, you might be feeling like you're having a panic attack, you might be doing a lot of pacing. So those would be kind of some of the symptoms to look for. it becomes clinically diagnosable when it's prohibiting you from doing your daily activities and you're having difficulty getting out of bed or difficulty going to work. Again, difficulty with just making decisions. That's when you would want to work with somebody and get help so that you can return to daily functioning.
And when would someone, because you're a counselor and you're a psychiatrist, when would someone come see either of you? And I'll let either of you jump in.
So I'm a licensed mental health counselor. People tend to see me when they are looking for individual therapy, group therapy, and then it's my understanding people would come to see you when they want to talk about medication management. Does that sound like it could be true?
Typically, I mean, I think people can come to either one of us to be evaluated. Like, so we both know what mental illnesses are, what they look like. My thought is if you're having symptoms that make you worried, see anyone, get an evaluation, and we can help direct you to where might be the best place for you to get help.
I would just add, I kind of like the way my psychiatrist basically said it was, and she was very, very dry. She was like, "Here, I'm not here to talk and be friendly with you. I'm here to like diagnose, and we're not going to get deep. I just need to know what you're going through." Whereas a counselor, you can kind of get a little bit more personal. You can kind of build more of a relationship. Not to say that you wouldn't have a relationship, but there are different reasons to see Gretchen or to see Dr. Kessler, correct?
Right. So I guess what I should add to that is, so I'm medically trained, so I have a medical degree, residency training, so we're most expert in understanding medical treatments for mental health conditions. I would disagree a little bit. I do want to have a relationship with my patients.
I love it. I should have
care
seen
about
you. I should have seen you the first time. So how would someone get diagnosed? How is mental health diagnosed for either of you in your fields?
So typically how that works is somebody would come in and do Memorial has walk-in assessments. So anybody from the community can come in and we would sit down with a licensed clinician and they do a series of questions, starting with, well, what brought you in today, right? And then it's an hour and a half long assessment that looks at what is your family dynamics, tell me a little bit more about the symptoms that you're having. There's different assessments that go along with it, like a suicide assessment scale, a generalized anxiety assessment, depression screening. We look at all of your physical health as well. Tell me the last time you went to see a doctor. Tell me what your nutrition looks like. Tell me how you're sleeping. So it's a very lengthy process. And then based on that, the clinician will decide based on the symptoms being presented, then can move forward with diagnosing. And then after that, like after they do their initial assessment, they are given an appointment to meet with a psychiatrist and do an eval with the psychiatrist.
So I'll add to that. Our diagnostic manual, our world of diagnoses in psychiatry has a couple of hundred diagnoses.
Huge book, huge book.
So part of our job is someone comes in, we hear their story and trying to say, do one of our diagnoses fit to what's going on with you? And we have a series of questions we always ask people about to try to get to that. I think the essential question I want to answer is, what's your pain? And then we go from there.
So when we were talking before we got up here, I had posed a question to you. Should there be, like we get a physical every year, or hopefully we should. Every man in the room said no. But should we get a mental health care checkup every year like we would a physical? What are your guys' thoughts on that?
I can quickly handle it. There has been a movement to have primary care doctors screen, at least for mental health conditions, more as part of their usual exam. I think that's where it makes sense, because hopefully you are seeing your doctor once a year.
Absolutely.
They should at least ask a couple of questions about mental health. One thing I'll say about the VA, and I've worked for the VA for 10 years, is they implemented a long time ago a standard that their general doctors ask certain mental health questions, ask you about depression, ask you about trauma, and so forth. So I think that's a good place for it to start.
You want anything, Rich?
Yeah, I definitely agree. And then I think for maybe a different conversation, it would be, well, what is the follow-up? Because when people graduate out of treatment or leave treatment, there is no, we'll see you in a year for a check-in. And I think we need to start moving towards that direction of what happens when a patient is discharged, what is their yearly checkup? Because when I go to my PCP, I already know when I go and see them again next year, but for mental health, we're a little bit behind to catch up with that.
Absolutely. So, in your guys' careers, how have you guys seen people masking mental illness?
Um,
Go ahead.
so some of the ways in which people might mask mental illness, right, is the stigma just to come in for treatment of, I can handle this on my own. I don't need somebody else. I certainly don't need to be in group therapy and talk about my problems. You might also see that with people using substances to try to manage uncomfortable emotions. There's also something called apparent competence, where people present like they have all this skill set and are functioning well, but on the inside they might not be. So those are some of the ways that I see it when I'm working on the front lines.
Yeah, we need sort of a greater permission structure for people to say, I'm hurting in this way, which people haven't had for a long time. I will say, in general, my experience with men is they never feel like they have a problem. And 9 times out of 10, it's the spouse or the girlfriend or boyfriend that tells you, you better go see somebody. So I think in particular, men have a hard time admitting because we're supposed to be tough and whatever. I agree with you about the substance use. I think a lot of people, if they're hurting, in our society, we have one way of managing that. Have a drink, use a substance. This is the acceptable way of managing when you're hurting psychologically. I used to ask my medical students, what's the most common drug for anxiety? They always got it wrong. The answer was alcohol.
Yeah, that will do it. And I think it's actually socially accepted, you know? It's like,
Totally.
hey, man, you're having a bad day. Let's go grab a drink. Let's go
The
grab
answer
a beer.
for everything.
Yeah, it is. Or, I mean, there are other ways of doing it too. I think we always think of drugs and alcohol and things like that, but, you know, you can be obsessed with your job. You can pour yourself into work at an unhealthy rate. You can do retail therapy. I mean, there's so many different things that
Avoidance.
people are, that are avoidance. Exactly. Yeah. So what would you say, Dr. Kessler, are some of the most impactful effects or determining factors to someone's mental health, whether it makes them, whether they're facing something or whether they're actually healthy?
Wow, that's a good question. I don't think we do a great job in this culture of teaching people how to take care of their mental health. There's been a greater awareness of self-care, right? We hear that word more these days than we used to. And we hear different answers from different people, but it's the kind of things you talked about in the video, like how many people are making sure they get a good night's sleep. Yeah. Are you making sure that you're eating healthy? Because what you take in affects your brain. Are you having enough time in nature? That's more. Are you spending enough time with family and friends? A lot of people get very sort of isolated and separated, and I think one of the toxic influences in our culture right now is loneliness. Our Surgeon General in the last couple of years talked about there being a loneliness crisis in this country, which has medical consequences. And so social isolation, being connected to other people is so important. It's how we are built as humans. So those are some of them. Knowing when you're in trouble, allowing yourself to get help instead of waiting or hoping it goes away. So those are some things that occur, to my mind.
I would say to piggyback off of that would be some of the biological factors. How did your when you were growing up, how are the people closest to you managing their mental health? How did you learn how to problem solve? How did you learn how to communicate your wants and your needs? One of the biggest skills that people need to learn is asking for help, because asking for help is going to be the one tool that saves your life, right? And then in conjunction with social isolation, there's something called the social determinants of health. And our hospital system has been looking at it with the research in the last year. So we have started looking at these 10 markers. One of them is social isolation. So when anyone scores high and they need social isolation, or sorry, they need social connectedness, we're linking them to peer support within the community and utilizing the powers of peers. So, and peers are people who are in recovery themselves from mental health, substance use, or both. There are centers locally within our community, and I saw a bunch of them out here today, so I'm excited to see that, like calling 211, getting connected with an organization called South Florida Wellness. There's 9 muses in the north end of the county. Memorial has Rebels, which is a drop-in center that's open 365 days a year. And that is the idea of how do you get somebody out of their house to develop these social relationships and make friends, because of this isolation is so paralyzing.
And what role would you guys say in your experience that trauma, not just emotional, but physical, so pain, someone may have suffered a major injury or hurt themselves. What have you seen in your experience with trauma, both mentally and physically, the impact of that on mental health?
Trauma can be very debilitating, and it's different for everybody. You and I can experience the same thing, and due to what our past is, can have different reactions to it and understand it differently. So working with trauma, a complicated question, by the way, right? Because
You could do a whole thing on trauma.
You want to
Wait till next year, guys. We're doing this every year, guys. Get ready.
That's the next panel. But in going back, the focus of trauma, and there are organizations that provide trauma-targeted services, right? Your first thing is, how do you survive the crisis and get out of that and develop initial skills before you can start to process trauma?
Couple other thoughts. We know that early childhood trauma is a big determinant of adult, not only mental health, but physical health. So kids who grow up with deprivation as well as physical and mental kinds of abuse are much more likely to develop things like depression, but also have a lot more health problems.
Yeah.
So if we think about a preventative approach, we have to think about that. But you also mentioned an important concept when it comes to, because there's such an interaction between mental and physical.
Mm-hmm. Yes.
People who are in pain are actually much higher risk for suicide. It's a significant risk factor. So what's going on with the body and what's going on in the mind are deeply interconnected. I wanted to add earlier, when you're talking about anxiety, I always tell people that anxiety is a physical problem. Even though we diagnose it as a mental problem, like these things are so intertwined. And so physical pain, we actually experience it in our brains.
Yep.
So you have to pay attention to all these factors.
I remember going through therapy. One of the things my therapist was talking about was breaking the cycle of pain, because you can find yourself enveloped in a painful cycle, whether it's physical or emotional. And the goal isn't to get better right away. The goal is to break that cycle. So, and from a personal experience, not a doctor, not a counselor, but someone who's survived this, I think it's important that we all recognize if ourselves or someone we love are in that cycle of pain, helping them break that. Because I think you can kind of find yourself in a perpetual spiral downwards because of that, which could then lead to something that, Gretchen, I wanted to ask you about. What role does substance abuse play in someone's mental health? Because someone could maybe be completely fine, maybe they've handled their trauma as an adolescent or as a child, but then could dabble into substance abuse, which could, I'm assuming, open Pandora's box for them. Is that something you've seen? What role does substance abuse play in someone's mental health?
I think they're highly correlated. I work in the morning time, I work specifically in the substance use track. And so oftentimes, like when we're talking about depression and anxiety, substance use is going to increase those disorders as well. So when somebody has the ability to get sober, you'll see their depression scores go down. You'll see the anxiety scores go down. It is very hard when somebody is not clearly thinking to be able to process things like trauma, pain. Of course, they're using all these substances to mask all those things because it doesn't feel good when you don't feel good. So you're going to try to do anything possible to alleviate those symptoms. So I see it happening quite frequently. We also might see people who are trying to mask and manage their pain through illegal substances. So we're trying to work with them so that they can do things in a safe way, but also meet their medical needs and not experience pain.
Do you want to add anything, Dr. Kessler?
So as we were talking about before, people often will turn to substances to manage their mental health problem, and then all of a sudden they have this second problem. And it may become bigger than the first, because the thing about substance use is, by definition, people spend more and more time thinking about it, obtaining it, recovering from it, and it can take over your life. And then you're trying to just prevent yourself from feeling bad from withdrawal. So you have that, but also any intoxicant affects your brain in that it kind of stops you from thinking, and I guess that's the point of using it, but it kind of turns off your frontal lobes. There can be problems with that, right? So we kind of need our frontal lobes to make sense of things, make rational decisions. One of the things we know, to get to the theme of tonight, is when you're under the influence of a substance, you're much more likely to act on dangerous, impulsive ideas like, well, maybe the only way out of this is to die.
Yeah, and that's something I didn't realize till I was in the thick of it, right? It was, okay, I'll just have a drink, I'll get to tonight. And then that turned into 1, 2, 3. And then we're now on night 5, like I was saying in the video. I'm heavily intoxicated on both narcotics and alcohol. I'm not thinking straight, and then I'm going into it. And I know for the people who live with me and my loved ones and my family, it was hard for them to see. And I was lucky enough to like literally have my mom call me, and she was like, I need you to go get help. And so that's like my story, but I know you guys have seen hundreds of patients. Could you just give some stories of what does it look like? Because again, it's not just someone laying in bed. It's not just someone, thinking a lot. What does it look like for someone who's living with depression and anxiety?
I mean, in my experience, it looks like all of us.
Yes.
There is no age range. The oldest patient in the adult group is like in their late 70s. The youngest patient is 18. It is all educational backgrounds. It is all socioeconomic status backgrounds. It is everybody. What it might look like with somebody coming into the initial clinic is somebody who is just reaching out for help, feeling hopeless, and not exactly sure what direction to go, but they're willing to be there and willing to get help. But in regards to what does it look like, this is what it looks like.
Right. Yeah, I agree. I mean, a lot of people just suffer silently, and as you said, know how to put up a good front. But I totally agree. You were mentioning that. I always tend to bring up the story of William Styron. This is the author who wrote Sophie's Choice, you may know. He wrote of his own suffering with depression. He wrote it initially in Vanity Fair. It came out as a book called Darkness Visible. And what struck me about this is he starts off the book, he's flying to France to get an award for his writing, and he's in the throes of a horrible depression. And the most successful point in his life.
Yeah.
So it could be anyone. Absolutely.
Yeah, and it can come at any time, right? It just the smallest trigger can start a cascading effect. I call it the snowball effect, where it's just one little thing that can be as stupid as, you forgot to take the trash out. And that could spiral into, well, I forgot that. Well, I forgot this back in, 2 weeks ago. And that goes, I forgot this 3 years ago. And it spirals. And so it's not just people who are, like I said, sitting in bed, people who you see who may have a malaise or like a lethargy about them. It could be anyone, a high-functioning person, which is what you mentioned. Dr. Kessler, we were talking about these risk factors of suicide. What are the risk factors of suicide? What are things that present themselves that where you can kind of identify, okay, this person is at risk?
So I have to think about it with anyone who walks into my office, because having a mental illness is a high risk factor. So as I said, suicidal thoughts is one of the things that frequently goes along with depression, but it can go along with bipolar, schizophrenia, personality disorders was mentioned. So I think about it with any one of those diagnoses, although the vast majority of people with mental illnesses never contemplate or commit suicide. So you have to keep that in mind. But there are many other things to keep in mind. So one particularly notable risk factor is having a family member who's committed suicide. It creates a greater sense of this is within the realm of options, I think.
Yeah.
Particularly for a young person who's experienced this. So having a first-degree relative who's committed suicide. If you've attempted before, and most people, fortunately, who try to survive, though it does depend on the method, and I'll get to that in a second. But if you've tried it before, again, you've kind of given yourself permission. This is within my realm of possibilities of things I can do. So those are a couple of things. If this may seem obvious, but you've had a significant loss. I've lost an important relationship. Either a relationship ended or there was a death. Or I've lost some other significant thing that I rely on for a sense of my life being stable, my job, my housing. So big losses like that are a risk factor. Things that make people feel both helpless and hopeless. And those two things together are dangerous. The sense that I'm in a hole and it's never going to get better. And then maybe the idea that others would be better off without me even.
Yeah, that's it. Sorry, that hit a little bit. Gretchen, did you want to add? I wanted to ask this because this is something that I've kind of struggled with, but I've also noticed a lot of, I don't want to call them normal, but healthy, I would say, people struggle with the impact of social media. I think, no generation besides the one living today has ever experienced anything like this. We're connected like we've never been connected before. What impact have you seen, whether it's young adults, teens, all the way up to you guys? What impact have you seen with social media affecting people's mental health?
I think social media has made us connected, but it has not made us have these improved, deep, meaningful relationships. And that's what people are searching for. Just like when we were talking about a little bit ago, having social connections. Everybody could be connected to the internet, but if they're having difficulty getting out of their house, social media plays a role in that. Social media could also play a role in regards to, it's highly correlated with addiction, it's highly correlated with low self-esteem. So making sure if you are engaging in social media that you're doing it in a balanced format and you're not comparing yourself to other people would be helpful.
Say that again.
Don't compare yourself to others. You're great as you are.
Yeah, because comparison is the killer of content. It's going to kill your contentness. It's going to make you constantly be chasing the dragon down the hole because you're always going to be comparing yourself. And we always have to remember this is someone's highlight reel. This isn't someone's real life on social media. You're not seeing that. You're not seeing the arguments about taking the trash out or folding the laundry, right? Or who's picking up the kids. So I think it's really important to recognize that.
If I just chime in.
Absolutely.
Around the time that Facebook became a big thing, correlated shortly after that rates of teen suicide started going up. It is a big problem for kids. There's also the bullying. There's the comparison with others, but there's also a ton of bullying.
Absolutely.
And there's fear that gets wrapped up in that. I think it's been particularly toxic for kids.
Because it becomes, I mean, when I was growing up, I remember like, because that was when bullying was accepted, but you only had it at school. So if you went to school, you were bullied at school, and that was it. You could come home, you're in the confines of your home, hopefully with your friends and family, and you don't have to worry about it. But now you have this constant bombardment of people criticizing you, picking things out. Even when you think you're like, there are people who are literally living the perfect life, and there are just haters, trolls online, just trying to break them down. And so you have to have that wherewithal to understand, where am I at? And you mentioned an uptick in suicide. I don't think many people are aware of the copycat phenomenon that's regarded and tied to suicide. So when someone prominent will commit suicide, isn't there usually like a high correlation of an uptick in suicides afterwards? And why is that?
I'm not sure we know, but my guess is it increases that kind of permission structure, in the sense that it's more of a reasonable option somehow, or this is somehow okay to do. Or, what do you think?
I'm actually not aware of the research on it, so I'm not 100%.
Know something you guys don't know. Amazing. No, but moving on, with social media, I also kind of want to talk about what happened a few years ago with COVID. And because we were talking about isolation, and we know that when you're depressed, you're going to isolate yourself. What impact do you think COVID had in terms of isolating people, changing the dynamic of our economic structure in terms of people working from home, wanting to work from home? My wife will tell you everyone wants to work from home now. What impact have you guys seen in your field with what's happened since COVID?
Quite a few things changed, right? We had the opportunity to go through telehealth options, which I would caution anybody to use, because there is a difference between telehealth and being on a screen and what we are all doing right now, the social engagement component. People can hide on social media and hide on telehealth. So it's really important, especially when you're working with somebody who could be suicidal or using substances or having mental health disorders. It's really important to be able to see them face to face. We've worked, I know our department has worked with a lot of people who have been socially isolated, and to try to get them into the office to make an initial appointment has been challenging because their anxiety has spiked, because they're just not used to getting out. And then again, you see them also with the same struggles with social connection, because you're not developing those meaningful relationships, as small as they might be, with meeting somebody at the water cooler or going out to lunch with them. So there's a huge missing component to social connectedness just by working remotely.
I also think COVID was a huge trauma on our society.
Yeah.
So trauma, by definition, is something that makes you fear your life, right? So I feel traumatized when something threatens my life or the life of someone I love. So we all experience something like that. And I think us as a society haven't really come to grips with how traumatic it was or what it did to us. We all just want to put it in the rearview mirror and move on. So I don't think we've come to grips with it.
So we've identified, we've defined. I want to give people tangible things right now to go home with, either for themselves or a loved one. So let's say you recognize some of the things we've been talking about tonight, and maybe someone you care about confides in you. What's the first step? What's something someone should do?
So if a person comes to you and confides in you, I would say, don't leave this person alone. That's the first thing, right? You want to make sure they're safe and secure. Do not be afraid to break their, for lack of better words, confidentiality or what they're telling you, because your intent is to get them help immediately. You might be worried about, am I going to ruin the relationship by telling mom, by telling dad, by telling whoever, by telling a professional that this person needs help? Don't be afraid. You can repair relationships. You can't have a second conversation with somebody who's dead. So it's really important to make sure that safety comes first, even if you're afraid of losing the relationship with them. If it's late at night, there's organizations like 988, the suicide helpline. You can report to the nearest emergency room. You can say, hey, if you're having this crisis, let's make an appointment. Let's walk into this community provider and we'll get services right away. But first and foremost, don't leave them alone. And don't be afraid to break their confidentiality, because their safety is more important than the relationship at that time.
I think you want to listen. You want to hear, how deep is the pain? How long has it been going on? You have to be willing to ask people if they're in psychological pain. Do you ever feel so bad you think you'd rather be gone, that you wish something happened to you? Have you ever considered taking your own life? Now, I know there's a fear people may have that if I mention this, it'll put it in someone's head. I want to disabuse you of that. Anyone, first of all, if you mention it, you put it in their head, they're not thinking about it seriously. I wouldn't worry about it. People may feel relieved that you're willing to listen to that's how bad they feel.
Yeah.
I'll tell you what I listen for. Because a lot of people will sort of try to brush that question aside. Yeah, I've thought about it, and move on. Everyone thinks about it. Not a big deal. Tell me how much you've been thinking about it. So it's one thing for someone to tell me, I felt bad one day and the thought went through my mind and I dismissed it and I moved on with my day. I'm not worried about that person. The person I'm worried about is the person who can't stop thinking about it. I thought about it. I've asked this question. I've thought about it for a half hour, and I'll say to them, oh my God, a half hour is a long time. Like, what went through your mind? What were you thinking about? Like, what occurred? Did you think about how you do it? And then I want to know if they thought about how they did it. Did you do something to move towards that? Some people will research it on the internet. The internet can be scary this way. People out there put stuff on there about how to die.
Yeah.
Have you done research? Have you prepared something? So, and if I don't ask that question, I won't hear, I had all the pills in front of me. Or I had the gun and it was loaded in my hands. If they didn't do it, what stopped them? So those are things I want to know. But if someone tells you any of those scary things, as you said, you want to stay with them.
Yeah.
You want to put some distance between them and whatever that method is. And you want to make sure they're getting some help. And you stay with them until they get that help. I want to emphasize what you said, 988. Everyone should know 988 is the National Crisis Line. Point of pride, that started off, that idea came out of the VA. We had a Veterans Crisis Line that was started back in the aughts as an experiment in the VA, and it became so successful, it's now a national number anyone can call. 988, everyone should know it. Let people know.
988.
24/7. 24/7 you call.
So we had talked about some risk factors for suicide. Let's flip that on its head. What are some protective factors or reasons for living? We had talked about the reasons for living scale.
Yeah. So I want to put it in this context is suicide is always a conflict between reasons for dying, which we started talking about, and reasons for living. It is always an ambivalence and a fight between these two. So as much as I want to know about all those other things I talked about, I always ask, what makes you want to live? What holds you to life? If someone cannot give me an answer to that, I am very worried about them, whether or not they've told me they have a suicide plan or not. So someone can say immediately, my kids. I've had people like anything that depends on you that you know will suffer if you're gone. So I have people tell me, my cat, that's fine.
Bunnies.
Bunnies. Other people that depend on you, that's the most important factor, I think, that keep people tied to life, even when they're suffering. It may be their job. It may be, you don't know. But you want to ask people, what makes life valuable to you? And that's what you want to move people towards. Because if they're wondering about suicide, what keeps them going is those reasons for living.
Yeah, I agree with you. I think you hit them all. In regards to, do you have family members? Do you have pets? Do you have spiritual connectedness?
Yes.
Do you have friends? Do you have future-oriented thinking? Is there a goal that you're working on? In our practice, we call it, what is your life worth living goal? And how are we going to get you there?
That's amazing. I love that, your life with living goal. Gretchen, how would you approach someone who recently experienced a suicide, either in the family or a friend or a loved one? How does someone start that conversation? Because it's a very difficult conversation. What's the best way, if someone in this room may know someone or they themselves, how do you start that conversation?
I'm going to ask you to just repeat that question one more time.
So how do you approach, so let's say you know someone who's lost someone to suicide, and you know they're suffering, you know it's taking a toll on their life. How do you bring that conversation up to get them on the path to recovery and getting them healed?
Well, I'm not shy. So how I usually approach that is sitting and securing the space and just acknowledging and honoring them and keeping the safe space so that they feel comfortable to share. I understand their pain must be so great that it is really difficult to do. And if I could do anything to take their pain away, I would. But I am there to listen and to provide the support in any way that I can. So I usually just start with, how do you want this to go today? And I am here for you. And I'm not going to let you fall.
And how frequently should you be checking back in with that person?
We usually check in pretty frequently. When somebody is discharged from the hospital, we are making follow-up phone calls within 24 hours. Our protocol is if anybody comes in screening moderate to high risk, we have to initiate phone calls and do further assessments, review their safety plans. So we are in constant contact within 24 hours all the time until they are screening low risk, no risk, until they maybe don't need our support so much anymore. It is an ongoing conversation.
And so if someone is suffering from a mental health crisis or issue, there's always the question, do I go on medication? Do I take a holistic approach? I'd like to talk about medication because Trish had mentioned a dulling effect. I had experienced that. When is it necessary for medication, like a non-negotiable? And when do you think it's acceptable maybe for someone to get off medication and try a more holistic approach? Or is there a scale where you're like, okay, once we get past here, you gotta get on some sort of medication? Or if you're at this part of the scale, I think we can just take a holistic approach.
I'll address it. In my experience, people who have a serious, severe depression, I think are likely to need some kind of medically oriented intervention. One, because the consequences may be severe, as we've been talking about with suicide. I think they may be less likely to respond as fully as we'd want to with psychotherapy alone. Most of the time, most of us recommend psychotherapy along with medications. Someone has, but I think if folks are feeling, I don't like the idea of medicines, I don't want to have side effects, you're functioning, do therapy, do holistic, do exercise, do all the good things to take care of yourself. If that's still not working, medicines may be something that you want to at least consider. Talk to someone like me. There are some newer options, and one of the things we're we're doing in my practice is something called TMS, which is a treatment that does not involve medications, but involves applying a powerful magnet to parts of your brain that are not working right when you're depressed or anxious, and helping to stimulate those brain cells so they can function better again. So again, one of the benefits of talking to people like us is we can tell you about all these various options and help you figure out which treatment might make the most sense for you.
Right. So to piggyback off of that, I definitely agree that in order to get somebody to the stable point, if somebody's coming in very severe, in order to get them to the stable point, medication would be something to seriously consider. And then if a patient doesn't want to be on medication anymore, then just safely tapering off with medical guidance from a psychiatrist.
Don't just stop medicines.
Yeah, don't just stop. That's when you become dangerous. But a safe taper, and then in conjunction with therapy and what's called the please skills, so like physical exercise, sleeping, eating, establishing a daily routine, making sure your needs are met, then that would be successful. But don't just abruptly stop taking medication, because that is not effective for you.
Yeah, I would also add, just from personal experience, I think doing daily affirmations, reminding yourself of what you've done, what you've been through, because you're an incredible human. Everyone in here has a story. Everyone in here has been through something, and you've persevered because you're still here. So I think doing daily affirmations, as crazy as they are, I've been trying to get into this practice.
Not crazy.
I know, but it's a little weird. My therapist was like, I need you to look in the mirror every morning and for at least like 3 minutes, say daily affirmations to yourself. And I'm like,
Did it work?
no, it's very hard. It's awkward. I mean,
You don't have to look in the mirror.
I know. But then I feel even crazier, because then I'm just like, I'm a winner. I'm a dad. I take care of 3 human beings who are trying to kill me every day. Okay. But
So gratitude lists are also helpful.
Yes,
if
that's
you don't want to do
absolutely.
positive affirmations, then thinking about, well, what are 3 things that you're grateful for? So like when you go home tonight, what were 3
Absolutely.
things that you're grateful for?
I love that, because we do take so many things for granted. If you try this exercise, actually, that's your homework. Everyone tonight, you're going to go home, you're going to make a gratitude list, okay? And list them all out. And you'll be surprised how many things you take for granted, but I always say it like to my friends and our family, celebrate the W's. No matter how small the wins are, celebrate the W. Got to work, I didn't chew my work friend out. I didn't get reamed by my boss. I got home on time. Those are W's, you know? I also want to make a note about medication, because you had mentioned like it can be scary for someone to get on medication. You can back me up on this. Medication's not going to turn you into a completely different person. You're not going to become Dr. Jekyll and Mr. Hyde, right, Dr. Kessler?
That is correct.
But what I do think the benefit of medication is, as a person who's been on it, is it does help you break that cycle of pain. It does help you, as I like to say, bring you back to zero. It levels you out. And then from there, after years, months, whatever it takes, I mean, correct me if I'm wrong, you can then start to wean yourself off and develop healthy practices.
With medical guidance.
With medical guidance, everyone. Yes, with medical guidance.
Now, people may have side effects. That means it may not be the right medicine for you, or
Oh, yeah. I've been through
maybe
many.
it's the wrong dose. I mean,
My pantry looks like CVS. You should see it. It's insane.
yeah, it's a process to figure out what's going to help you feel and function well. If you're not feeling and functioning well, it's not the right treatment.
Absolutely. And the other thing, too, is my psychiatrist told me this, and this is something I would want to leave with you guys, too, is when you get an injury, right? You tear your ACL, you break your arm, what do? You go see a specialist, right? Because you need to treat it. It's the same thing with any sort of traumatic event, if any sort of loss, like we were talking about earlier for the risk factors. You need to go talk to someone. You need to go see a doctor. You need to go see. It doesn't mean you're weak. It actually means you're intelligent, you're smart, you have a wherewithal about your body that you know that I need to go get help. So I'm going to wrap this up. I want to thank you both for being here, and we will now pitch it to a Q&A, right, ladies?
Actually, I think just to respect everyone's time, unless there's any very pressing questions, the panelists will be at the reception. We're going to the rooftop after this. Thank you, everyone, for being here. This is a very candid conversation and one that we needed to have. And we talk about mental health a lot. We don't talk about suicide a lot. So I hope it was helpful. I hope that you all have resources. Everyone who registered will get an email version of the manual. We created the manual because people who are in crisis don't Google. So hopefully this helps you. We really appreciate everyone, and we hope to see you upstairs.